Hello, my name is Dr. Dewan S. Raja. Today I will discuss about infantile hemangioma. This is a very common tumor of the blood vessel in the skin of an infant. So it is a benign vascular tumor due to proliferation of endothelial cells, typically appearing within the first weeks of life. Endothelial cells are the inner lining of the blood vessels. These are the vascular epithelium along the lumen of the blood vessel. Epidemiology affects 4 to 5% of infant, more common in females, 3:1. Premature infant, they have more chance to get hemangioma, low birth weight, and Caucasian race. It is a common tumor. It is 4 to 5% of the infant may be affected by hemangioma, but some statistics shows it may be up to 10% infant with infantile hemangioma. So this is the infantile hemangioma. It may happen in the arms, other parts of the body, but head and neck is the common site, and this is the reference infantile hemangioma. If we go to another, here this is from the New England Journal of Medicine. This is their credit, and this is the hemangioma involving the eye here. Okay, and this is the treatment. Then the the response to treatment. So it is manageable response to treatment here. Okay, so hemangioma is manageable. It is self-controlling disease. Okay, so but still it may take many years to disappear after its entry. So treatment is essential. It is self-limiting, but that is not very quick. It may take several years to disappear. Okay, so what is the pathophysiology? Pathophysiology is caused by endothelial cell proliferation, possibly triggered by hypoxia or placental emboli. Two phases: proliferative phase, rapid growth, 0 to 6 by 12 months. So it may happen within a few weeks after birth, maybe within 1 year. Involution phase, slow regression over years. Clinical feature: onset 1 to 4 weeks after birth, type superficial, bright red, raised strawberry color, deep, maybe deep bluish, soft, mixed both components, superficial and deep. Location: head and neck, mostly 60%, trunk 25%, extremities about 15%. Complication of hemangioma: ulceration, most common. There may be bleeding, obstruction of the airway, obstruction of the eye, cosmetic concern. Okay, we to remember that hemangioma may happen around the oral cavity, even inside the oral cavity, around the lip, inside the oral cavity. Also possible, so it may obstruct the airway. Eye, it may happen on the eyelid, so that may obstruct the visual pathway. So there may be complication like, okay, cosmetic concern. Certainly parents are very much disappointed. child, the high output cardiac failure is a possibility in large multiple lesions. We have special type of infantile hemangioma with that of some complication called, we can remember this way, the faces syndrome with segmental facial infantile hemangioma. There may be involvement of the posterior fossa. We may have posterior cranial fossa anomalies, hemangioma inside the cranial cavity, arterial anomalies, cardiac defect, eye abnormalities, sternal clefting, and supraumbilical raphe. So this may be associated with infantile hemangioma, the faces syndrome. Diagnosis, clinical diagnosis, ultrasound depth/flow evaluation, MRI complex segmental lesion. We may see what is inside the cranial cavity. Is there an involvement of the posterior cranial fossa? Is there an involvement of the circulation over the brain and spinal cord as well as on the cerebellum? So we need MRI, complex segmental lesions, biopsy, rare for uncertain cases. Treatment, observation, most regress by age 5 to 10. Medical treatment is very important, like propranolol, this is a revolution, oral beta blocker, first line of therapy. Topical timolol, small superficial lesion, this is also a beta blocker. This is a selective beta blocker. Okay, timolol, small superficial lesion, we can use that. So laser therapy may be required, ulcerated or residual lesions, surgery for complications or deformity. So this is the treatment option. This is non-selective beta blocker. This is the revolution in the management of hemangioma. And that's all about infantile hemangioma. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.